It is.
Are you sure?
It's
Sure. Okay.
Hey everyone, my name is Dr. John Robinson,
And I'm Dr. Christina Bosch,
and we are
the Sex Docs.
the Sex Docs. Today we are going to talk about the Oshot. Yes, and it is actually going to be, it is that O that we're referring to, the big O.
Which O?
That orgasm. You know. You know. So
The
that's
orgasm shot.
That's what we're going to be talking about today. A little bit of housekeeping. Remember to share this video. Share it with some friends, some family members that you think might benefit from what it is that we do here at the Hormone Zone and what the Sex Docs talk about every week. And actually not every week, because we did miss you a couple of weeks here. We've been doing some other things, and we're back.
We're back.
So today's about the Oshot. Again, share the video. Next week, and I'm going to say it now and I'll say it again a little bit later, but next week we're also going to be talking about how estrogen is metabolized properly in the body and what you can do in order to prevent benefit from that and what you can do to actually make that happen. So we'll be talking about that next week.
And we'll talk a little bit more about that, but I just want to let our audience know why that's important. Think about things like breast health or ability to lose fat or even detoxification. So you want to tune in if you're not sure what estrogen metabolism is all about to learn a little bit more about your bodies.
Excellent. But today, it's all about that O.
Yes.
So let's get into that a little bit. The name of this particular video is the Oshot, Activating the Female Orgasm System. And I'm referencing the book by Dr. Charles Runnels. Dr. Charles Runnels is the guy who invented the Oshot about 7 years ago. He's from Alabama, and really excellent, easy, concise book to really let you understand about this. But what's really cool about it, he's actually kind of coined this concept of the female orgasm system, that it's just like any other system in the body. We don't often look at it that way, do we?
That's right. And like any other system in your body, you want to make sure you're taking care of it and that you're practicing prevention with regards to the deterioration of its health.
Yeah, and that there's all these different components to be able to help with those components of health for the orgasm system for women. It's not just something that's kind of there or not there. It's something we need to sort of nourish, and there's ways to, if there's problems, there's ways to fix it. And it might be that the Oshot is one of those things. So let's talk a little bit about what the Oshot is. So we use something called PRP, platelet-rich plasma. Now what platelet-rich plasma is, and this is we've talked about this before in some other videos, this is we draw up your blood and we put it into a special tube, and then we spin it down in a very special centrifuge, and it separates out the red blood cells from the sort of liquid portion, or the what?
Liquid gold.
The liquid gold portion of your blood. And then we can re-inject this back into the body, anywhere in the body. And Dr. Charles Runnels had figured out that you can actually inject this in and around the areas of the vulva for women.
So 7 years may not sound like a super long time for a therapy to be around, but it's been so successfully tracked on thousands and thousands of patients that it's incredibly reliable, and it's something that we stand by because, of course, we've had the benefit of seeing those results here in office, but then also, again, the research is pretty indisputable, we would say. Yeah,
and in fact, Dr. Charles Runnels, the group that we're a part of, and there's physicians trained from all over the world as part of this group, they're in the process of getting actual NIH funding to be able to do a double-blind, placebo-controlled study with this, which is really cool for something like this type of procedure. So, and again, it's got this track record with thousands of patients being able to see benefit. Research projects are very important, obviously, for the advancement of medicine, but anecdotal evidence is invaluable. Absolutely, and we'll take it where we can get it for sure. And I think anecdotally, we're seeing a lot of people benefit from it. You can find these things all over online, and certainly go into our website and get some extra information too. So back to the PRP. So we are able to separate PRP, which is again that platelet-rich plasma or liquid gold, which is a concentrated version of your body's own healing powers, right? And then we systematically re-inject it back into the tissue. And as John mentioned, you can inject it anywhere. We've talked about hair for hair growth. We've talked about putting it into the skin, and we'll keep talking a little bit more about that. But when you're injecting it into the female genitalia, you're using it for many reasons, not just orgasm. So maybe we can talk about those other reasons briefly, because we really want to focus on the female orgasm system. Sure. It's regenerative. It's regenerative to the tissue. So we look at orgasm, whether for men or women, on 3 different levels. The first level is, of course, the brain level. We talked about this in another video. And there's ways to stimulate the brain in a certain way to induce orgasm and arousal. The other level is the hormone level, and that's certainly what we focus on here. That's the foundation, really, of all of it. That includes things like testosterone and estrogen. And then finally would be the tissue level. So PRP, as we reintroduce this back with the injection, it can literally regenerate nerves, blood vessel, and really change tissue to get to the point where we bring back that health to the entire area.
Right. So when you're talking specifically about female genitalia, you want to be thinking about some of the disease processes or symptoms that one would complain about. Things like urinary incontinence, when the urine just doesn't stay where you want it to stay. This is something that is found when a person is perimenopausal or is having hormonal decline or postmenopausal. It's also seen in women that are younger postpartum. So the use of PRP re-injected back into the tissue around the genitalia can be an excellent solution. For many women, we say one and done, an excellent solution for helping with incontinence. This is all bringing us back to the notion of female orgasm, because having discomfort or having weakness of the tissue in the genitalia, again, the vaginal tissue and around the urethra where urine comes out of, those are definitely burdens to feeling sexy or wanting to have an orgasm.
It's a block to the whole thing. So if you don't feel like you want to, you just won't. And if you can't, you just won't.
You just won't.
Yeah.
And not feeling like you don't want to, that takes it back to the brain.
Sure.
So one of the things that may make a person not want to have sex is having decreased sensitivity at the level of the clitoris, as well as laxity of the vagina. You will often hear, or hopefully you will hear, your girlfriends complain or your wives complain about the fact that when the vagina is too loose, penetration is just not sensitive enough to cause internal orgasm. And then if the clitoris is not sensitive enough, then external orgasm is also very difficult.
Sure. So so the laxity, the helping with the incontinence, strengthening those areas in and around the vulva, it's pretty cool. Just this past week on Friday, I had the honor of being able to work with two women, two great women who are they're friends, and they've been friends for years. In fact, they tell this story also that they were right there with each other when they went through menstruation for the first time, and it was like this very intimate kind of big deal for them at that point. So both of them, as friends, decided, and they are lovely patients of ours, and they decided they wanted to do the Oshot. So they did it together, not exactly in the same room. It wasn't like this sort of like couples massage thing, but pretty much. I mean, we had two treatment rooms right next to one another, and I went from one treatment room to the other, and they did it basically at the same time. Came in together, left together. It was a really cool thing, and still early out here to kind of see. But so far so good by what little reports I've heard already.
It's an excellent rite of passage, and it's kind of like you go out with your girlfriends, you have lunch, and then you get your nails done. Well, perhaps in this case you're going to go out, have lunch, come to the doctor's office, and get your vagina injected so that you can later talk about how great your sex was that night.
Absolutely. And look, and it was, I think the actual procedure time when I was for both of them was 30 minutes. Yeah. They were here a little bit of prep time before and after and all of that, but the actual procedure itself, really, really fast. Relatively virtually painless, pretty simple to do, and it's just a really great thing to be able to offer for people, because a lot of people have issues with it. Millions and millions of men and women are having issues with sexual arousal, erectile dysfunction, or in the case for women, there are these sensitivity issues, the incontinence, and this just provides this really, really cool benefit. Here's one thing I wanted to say. When we work with hormones, and when it comes to incontinence, you brought up incontinence, hormones, particularly estrogen deficiency, well, I'd even say testosterone too, but definitely if a woman's in menopause and she has lack of estrogen, you give her some estrogen, and incontinence has helped so often. It's unbelievable, and especially with how we utilize advanced hormone replacement therapy here, we normally see benefit, but not always. So this helps to affect that direct tissue level in ways that hormone couldn't even hope to do. So when we put the two together, then we have fantastic results, right? Yeah.
So if you're sitting there thinking, okay, well, how is this applicable to me or maybe someone I know? The patients that usually will want to inquire a little bit more about the Oshot, we would encourage you to do so. Remember we talked about last time when we talked about having that good, open, honest communication with your physician about sex and sexual dysfunction. So if you're concerned about incontinence, so this could be as simple as you're at the gym working your butt off, and every time you try to jump rope, my favorite example, you leak a little bit. It could also be people who are finding that internal orgasm is difficult. So internal orgasm would be what? Penetration alone?
Penetration alone, and this would be somewhere maybe near what's classically known as the G-spot, which, by the way, one of the areas where we are injecting is... Oh, there's that.
All right, we have to make sure. I forget about it.
There's always some kind of technical difficulty, but that's what makes it fun when
it's
you're
live.
doing things like live. What was I saying? Something
about G-spot.
Yeah.
PRP
G-spot.
injection.
Yeah. So this is one of the areas where it goes into, and so not all women can experience an internal orgasm. And if they can't, it doesn't mean that there's a problem with that per se. But a lot of women maybe have in the past, but they haven't as they've gotten a little bit older, as things have changed in the area, postpartum, whatever. So this helps to regenerate that area to be able to help.
Yeah. So what we would say is if you find that you can't have an internal orgasm, then don't just assume that it is what it is. Explore your options. Perhaps something like PRP injections into the G-spot would be helpful. Then we have the external orgasm. So we can also inject around and into the clitoris for the purpose of, again, remember John mentioned that this is restorative. This is tissue and nerve regenerating. So you're literally bringing more blood supply into the clitoris, and you're bringing more of those nerves into the clitoris, allowing it to be more responsive to stimulus and making orgasm not only a little easier, but also just a better quality.
Right. So, yeah, and that's one thing I was going to mention too. There are some biopsy studies that have been done to where you can see what the tissue looked like prior to the PRP injection and what it looked like after. So there's definitely some distinct changes that's happening in and around the areas of the vulva to help with that orgasm.
And from a side effect perspective?
That's the great thing about this. Because it's PRP, it's your own blood, you can't reject it. In over 20 years of using PRP out there, in orthopedic settings particularly, there's never been one reported negative side effect or rejection from PRP, so it's amazingly safe. And as far as the Oshot is concerned, there's very few real relative side effects that occur the way we do it. Now here's the thing. There are some other people out there that are doing something that's similar, but they aren't actually trained in the actual Oshot and registered to be able to use that term and know exactly what to do. So there are some distinct things of what you need to know to do in order to prevent any potential side effects with that. The only real thing that maybe we've seen is some incontinence that might happen after, just from a volume effect that goes in the area. But again, it's extremely rare, and now that it's been sort of standardized in how it's done, we don't even really see that.
So when you're making decisions about making a medical decision for intervention, then I think there's three things you really want to think about. You want to think about how invasive is it, and this is not an invasive procedure, it's an outpatient procedure. You come into the office, 30 minutes is about, it's a very generous amount of time. The procedure itself doesn't take that long.
We have to numb you up first.
We have to numb up the area.
A lot of
which
numbing.
We didn't mention. A lot of numbing. We can talk about the procedure. It's a lot of numbing. Literally, I think that may be one of the most uncomfortable parts. You can use your parts as soon as you want. Really, once the numbing wears off by the evening.
Sure.
So you think about how invasive it is. You think about how effective it is. The Oshot is considered an incredibly effective procedure because usually you only need one procedure, and even if you need another one, then you're usually just talking about 2 procedures. Right.
And perhaps it could be more than that. There's a condition called lichen sclerosis.
Yeah.
There's a plaque that can form. It's an autoimmune condition where there's a plaque that'll form on the vagina and the areas of the vulva. This might need more frequent treatment. But as far as the classic Oshot, what we're really talking about here today, often 1 and done, maybe 2.
Yeah, and again, thank you for clarifying. It really obviously depends on the diagnosis, the purpose of the procedure. So we talked about how invasive it is, we talked about how effective it is, and I would say the last thing would be how many side effects perhaps the procedure comes with. Sometimes side effects are a necessary evil for a procedure, but in this case, as John's already mentioned, there's no side effect profile that we're considering.
Yeah, and an 80% effectiveness rate, which is what the Oshot group has kind of calculated so far at this point. 80% effectiveness on a procedure is just...
It's very good.
It's really high.
Especially for something with
no side effects.
No side effects.
Right.
I mean, it's a pretty easy risk. So, what else?
That's the Oshot. And, again, we encourage you to go to our website to check it out. Check it out online. There's a lot of forums out there that I've seen. People are just getting great results from it. It works. And we're starting to see some great results with our patients too.
And if you're not sure if it's the right procedure for you, then please, by all means, set up a consult and we're happy to discuss the specifics with you.
Yeah. And I'll leave you with this. Here's the thing. We always look at comprehensive care with what we're doing here. We want to look at the whole picture the best we can. So this is one of the things that we're doing because we're able to offer hormone replacement therapy and a procedure like this simultaneously. Maybe some doctors are just doing hormones and they're not doing something like this, maybe vice versa. But we're bringing it all together because ultimately we're trying to really activate the female orgasm system, or we're trying to help men restore full function sexually as well. It's just really a big passion for both of us to be able to bring this to people in a comprehensive fashion.
Yes. I really like that you hammered home that concept. The reality is that the more holistic the care.
Was I hammering? Or was I?
Like a Thor hammer.
Oh, like a.
You only need to yield it once.
Oh, wow. You really bring that back, and you make me feel good about it. I appreciate it.
It's the Oshot.
Yeah.
But what I wanted to say was that holistic care is definitely going to be the thing that hopefully is separating the sex docs apart from the other docs, that we are able to have an open conversation with our patients about sex. We're able to have an encouraging conversation about sex, where our philosophy is don't settle for mediocre sex, and then intimacy and how that will affect the rest of your life. And then from there, we're talking about the hormone levels as well as the brain levels. Are you in a state of mind where you can even enjoy having good intercourse? If all of those places are there and you still need some tools, well, our goal is to give you as many options as possible, and the Oshot is definitely one of those.
It is. Activating the female orgasm system is really important. That's maybe a good segue. One of the other things that we can do with activating the female orgasm system, or just sexually, is it also helps with your immune system. So there was a study that came out in 2015. I came across some research out of Indiana University, and what they actually found was that there was 30 women, and they split it in two groups. 15 women were regularly having sex, and the other 15 were abstinent. And what they were studying was what was going on with their immune system in relationship to whether they were or weren't having sex, in relationship to what was going on at the different time of the month for them. So these are younger women who were still menstruating naturally. So what they found was that we're always thinking about ovulation as being this time where you can get pregnant. And in fact, it's not necessarily exactly only at this 1 or 2 day window that you can get pregnant, plus or minus around ovulation. And one of the things was that women who had more frequent sex outside of just simply, the ovulation time frame, or just having sex throughout the month, actually shifted their immune system in such a way to accept sperm. Now, here's the thing about sperm. It's technically a little foreign invader, those little buggers coming in there. So it has to be accepted by the woman. And so the immune system is designed to very much defend. So if you can shift the immune system in a certain way, particularly in the second half of a woman's cycle, what's called the luteal phase, where it's essentially preparing for pregnancy just in case. During the luteal phase, if there is a different shift in the immune system, you can actually increase the chance of getting pregnant.
Successful conception.
Yeah. So I thought that was really exciting.
That's a great science to our artisans.
Yes. This was our shift into the artisans of sex. So there's the science portion of that. I don't know, what's maybe the artful summation of all of that? What do you think?
Well, I think it's important to mention patients that are in their procreative years, because when we think of female sexual dysfunction, we often assume as a society that we're talking about peri- and postmenopausal females.
Right.
And the reality is that that's just not true. It could be said that some of the difficulty with fertility nowadays has to do with the fact that women of any age are just not enjoying sex. That's a problem, because the best way to get pregnant is have more sex.
Weird.
So we actually do get to see a lot of patients. I get to work with a lot of women that come to me for preconception counseling. I always say, getting the womb prepared for accepting, apparently not just the baby, but accepting the little foreign invader that John said. My artistic spin to this notion of female sexual dysfunction is that you have tools, use them, and then work with each other. Remember that your best tool in successful sexual health is a partner that you want to welcome inside of you. And literally, a partner that will help you create something so brilliant that may result in another life.
Mm.
So my art,
That's beautiful.
my 2 cents for the art form is have more good sex.
I like that. We definitely always want to have it good whenever we can get it. And of course that's helping with conception. Again, it's even helping stimulate the immune system.
Your immune system.
Yeah.
That's right.
So I thought that was a good summation. It was
That was
beautiful,
fun.
actually, what you said. And yeah, I think this was a lot of fun here. So, there goes that light again. I don't know. We're wrapping up here.
We're wrapping up.
So, again, my name is Dr. John Robinson, and here's definitely what we know for sure.
Hormones are sexy.
The Oshot is sexy, for sure. And we will be bringing this more and more to you. Next week, again, we're going to be talking about estrogen metabolism, how to clean up the bad estrogens, how to shift things around the way it should be, real simple interventions to be able to help us, some natural supplements to
How
be able
to
to
know
help
if
with
you're having
Yeah.
inappropriate estrogen metabolism.
that. And then what exactly to do about it from a natural standpoint. We'll see you next week, Tuesday, 12:30.
Have a wonderful week.
Bye.